Hello, everyone. As a healthcare professional, I understand that facing health issues, especially those related to the kidneys, can be daunting. Today, I want to talk about an important topic: the skin signs of kidney disease. If you have kidney disease, you might not see early warning signs on your skin. However, as the disease progresses, various skin changes can occur. Recognizing these signs early can help manage the disease more effectively. Let's dive into these symptoms with examples to better understand how they present and what they mean for your health. 1. Dry skin. One common change is skin dryness. Patients often notice their skin becoming rough and developing scales, similar to fish scales. This is particularly common in those with end-stage kidney disease requiring dialysis or a kidney transplant. Dry skin occurs because the kidneys cannot maintain the balance of minerals and nutrients in the body, leading to dehydration and the loss of essential oils. Example: Sarah, a patient with advanced kidney disease, noticed her skin becoming unusually rough and scaly. Upon visiting her dermatologist, she was diagnosed with end-stage kidney disease. Early detection allowed her to start appropriate treatment and manage her condition effectively. 2. Itchy skin. Extremely itchy skin is another symptom of advanced kidney disease. The itch can range from mildly irritating to life-disrupting. It may affect the whole body or be localized. Frequent scratching can lead to raw, bleeding skin, sores, thick, leathery skin, or itchy bumps. If over-the-counter treatments don't help, it's crucial to see a dermatologist. Treatments like ultraviolet B phototherapy can provide relief. Example: Emily experienced severe itching all over her body, disrupting her daily life. Her dermatologist recommended ultraviolet B phototherapy, which significantly relieved her symptoms and improved her quality of life. Counterexample: On the other hand, John ignored his itching for months, thinking it was just dry skin. By the time he sought medical advice, his kidney disease had progressed significantly, leading to more severe complications. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. 3. Skin color changes. When the kidneys stop functioning properly, toxins build up in the body, leading to skin color changes. You might notice your skin turning pale, gray, or yellowish. Some areas may become darker, and if itching persists, the skin can thicken, develop bumps, and form cysts or whitehead-like spots. Example: Mark noticed his skin taking on a pale, yellowish hue. Concerned, he visited his doctor, who confirmed that his kidney function was declining. Early intervention helped manage his condition more effectively. Counterexample: Conversely, Lisa dismissed her skin color changes as a normal part of aging. Unfortunately, this delay in seeking medical advice resulted in a more advanced stage of kidney disease when she finally received a diagnosis. 4. Nail changes. Kidney disease can also affect your nails. People with advanced kidney disease often develop a white color on the upper part of one or more nails, with a normal to reddish-brown color below. White bands running across one or more nails are also common. These changes occur due to the accumulation of toxins that the kidneys can no longer filter out. Example: Jenna noticed white bands across her nails and consulted her dermatologist, leading to a diagnosis of advanced kidney disease. Early detection allowed for timely treatment and better management of her condition. Counterexample: Alex ignored the changes in his nails, attributing them to aging. This oversight led to a delayed diagnosis and more aggressive treatment for his kidney disease. 5. Swelling. Swelling, also known as edema, occurs when kidneys can't remove extra fluids and salts from the body. This fluid buildup can cause noticeable swelling in your legs, ankles, feet, hands, and face. The swelling is due to the body's inability to expel excess fluids, leading to fluid retention in tissues. Example: Rachel noticed swelling in her ankles and hands. Her doctor identified it as a symptom of kidney disease, and early treatment helped manage her condition effectively. Counter. Example: Michael thought his swollen ankles were due to standing too much at work. Ignoring the swelling led to further complications, and by the time he sought help, his kidney disease had progressed significantly. 6. Rashes and blisters. Kidney disease can cause rashes and blisters. You may see small, dome-shaped and extremely itchy bumps that can join together to form rough, raised patches. Some people with end-stage kidney disease develop blisters on their hands, feet, and face. These rashes occur because the kidneys cannot filter out waste products, which then accumulate and irritate the skin. Example: Laura experienced itchy rashes on her hands and feet. Her dermatologist connected these symptoms to her kidney disease, allowing for a more comprehensive treatment plan that addressed both her skin and kidney health. Counterexample: Steve thought his rashes were just an allergic reaction and tried various creams without consulting a doctor. This self-treatment delayed the proper diagnosis and treatment of his kidney disease. 7. Lumps on the belly. A lump on your belly can be a sign of kidney cancer. While early-stage kidney cancer seldom causes symptoms, it can cause a mass or lump on the side of your abdomen, belly, or lower back as it advances. However, an abdominal lump could be due to many other reasons, so it's crucial to consult a doctor if you find any lump on your belly. Example: David discovered a lump on his abdomen and promptly consulted his doctor. Early detection of kidney cancer allowed for effective treatment and a better prognosis. Counterexample: Sarah noticed a lump but assumed it was due to weight gain. This delay in seeking medical attention resulted in the cancer advancing further, requiring more aggressive treatment. 8. Calcium deposits. Calcium deposition in the skin is another sign of kidney disease. Some people develop deposits of calcium around their joints, which are typically not painful, but can cause discomfort when they occur within a fingertip, leading to significant pain. If these deposits break through the skin, you may see a chalky discharge. Example: Mary noticed a painful, chalky discharge from her fingertip. Her doctor identified it as a calcium deposit related to her kidney disease and provided treatment to manage her symptoms. Counterexample: Tom dismissed the calcium deposits on his skin as minor issues and did not seek medical advice. This led to more severe pain and complications that could have been avoided with earlier treatment. 9. Seeking professional help. If you experience any of these signs and symptoms due to kidney disease, it is crucial to contact a dermatologist. While not all skin symptoms can be entirely cured, many can be alleviated with proper care and treatment. Early detection and treatment can significantly improve your quality of life and help manage the progression of kidney disease. Example: Laura, who noticed several of the symptoms mentioned, promptly consulted a dermatologist. Early intervention helped manage her symptoms effectively, allowing her to maintain a better quality of life. Counterexample: Robert ignored his symptoms, thinking they were not serious. This led to a late diagnosis and more aggressive treatment, which could have been mitigated with earlier medical attention. Conclusion: Recognizing the skin signs of kidney disease is essential for early diagnosis and effective management. Symptoms like dryness, itching, color changes, nail alterations, swelling, rashes, lumps, and calcium deposits can all be indicators of underlying kidney issues. Proactively seeking medical advice and treatment can lead to better health outcomes and an improved quality of life. Remember, if you notice any unusual changes in your skin, consult a healthcare professional promptly. Taking action early can make a significant difference in managing kidney disease and maintaining overall well-being. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment great to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you.